Round our pub. Good afternoon, everyone, and welcome to this afternoon's Public Health Network Cymru's webinar. My name is Rachel Lewis, and I'm going to be chairing this afternoon's event. Just a little bit about me before we start. I'm both a Public Health Network Advisory Board member and also Principal Public Health Practitioner within the Betsy Cadwallader Health Board's local public health team. And recently I've just completed a secondment working for Public Health Wales Health and Work team, and so I'm really interested in this agenda. So this afternoon we're going to be talking about workforce health in Wales, and we know that a range of issues such as the pandemic, such as the cost of living crisis, our ageing population, rising levels of ill health generally across the country have all impacted on increasing economic inactivity rates. And yet these are some of the challenges facing employers and the workforce in Wales. So while some of these things make prominent headlines, this afternoon is about exploring what does this all mean for workforce health and the economy in Wales, and how can we support employees to access fair work and employers to create healthy, thriving workplaces for all people. So we've got a panel of experts who are going to explore some of these issues. We have Dr. Brendan Collins, who's the head of Health Economics, Advanced Analytics and Policy Modelling within Welsh Government. Lois Griffiths, who's a Senior Public Health Officer within the Research and Evaluation Team in Public Health Wales. Dr. Eliza Vinia, Research Associate for the National Centre for Mental Health, and Geraint Jones-Griffiths, who's the Lead Ambassador for the Engage to Change programme. And then Mary Ann McKibben, who is Consultant in Public Health, who leads the Healthy Settings work within Public Health Wales. Before I hand over to our speakers, a little bit of housekeeping from me. So after the presentations, as per usual with these events, there'll be a chance for you to ask your questions. In the meantime, if you have any questions as the presenters are speaking, please use the chat bar to type in your questions. And obviously we welcome questions in both English and Welsh. We're recording this afternoon's session, so that's going to be available to everyone on the Public Health Network Cymru's website after the session is finished. And if you experience any difficulties with any of the technology as we go along, please just let us know through the chat, and there's a whole team of people who can contact you directly to try and sort that out for you. So that's housekeeping over. I'm going to hand over first of all to Brendan, who's going to talk us through some of the data. Brendan, you're on mute.
Sorry, that's it. Prananda, everyone. So I'm going to talk about what policies do we need to maintain older people in the workforce. So these are the kind of current questions that we've sort of been grappling with. So how many people are leaving the labour force, and how much of this is due to ill health? How much of it is due to other factors like the Great Retirement? Is this a new trend since the pandemic, or is it a longer term trend? Are these health issues likely to be directly or indirectly related to COVID infection, or is it related to things like lack of NHS capacity, so long waiting lists for surgery? And what is the policy response? So there's a dynamic relationship between health, human capital and productivity, and this can be broken by different things. So if people are in work that's detrimental to their health, if they're overworked, or if people have got people can't find jobs, then that's also detrimental to their health. We know that sickness absence in healthcare workers due to stress and anxiety has increased in recent years. We get quite rich data on sickness absence in healthcare workers. And this is from the Financial Times. So John Byrne Murdoch in the Financial Times does quite a lot of good, nice sort of infographics using data from labour force survey. And I think what's most interesting in this is on the right hand side, the big increase in people suffering from multiple health conditions, so people suffering from 2 or more or 3 or more conditions. So it's this increase in complexity and increase in multimorbidity. I think that is one of the drivers of having more people with ill health in the workforce and potentially more people leaving the workforce as well. This is from the Office for Budget Responsibility, and you can see that long-term sick has increased as a proportion of inactivity. There's also been an increase in students, which I think has gone down a little bit, but I think part of that is related to people getting better A levels than they thought they were going to get during the pandemic as well. And you can see there's also an increase in retired as well. Within Wales, so this is some data from Labour Force Survey specifically for Wales that was analysed by Alex Fitzpatrick from our Knowledge and Analytics Services in Welsh Government. And you can see that the biggest reason for economic inactivity is long-term sick, and this is increasing over time. So this is the yellow bit on this chart. And economic inactivity due to long-term illness is still not as high as historical rates overall in males, but for females it's the highest that it's been during this time period. So going back to 2004, so we are seeing quite a steep increase, and it's particularly high in females than it's been before. This is from Public Health England, so this is from a few years ago, but I think it's got some interesting data. So for instance, the proportion of people who are carers who are also in work. So I think a lot of people might be caring for parents or other relatives at the same time as work, and so they might be caring for older relatives. And job seekers aged 50 and over experienced longer periods of unemployment as well than younger job seekers. And I think what's happened in the pandemic is people being furloughed and the whole kind of job market has been thrown up into the air a little bit, and that's changed things quite a lot, particularly for older workers. Now, in terms of how long this has been going on for, this is from analysis from the Institute for Fiscal Studies, and most people who are long-term sick have been out of work for at least 5 years. So this suggests it's not something that's happened just since the pandemic. It's almost more of a longer-term trend that's been exacerbated by the pandemic. And there's this work this is just looking at England, but this is looking at the productivity benefits of reducing NHS waiting lists. So this was looking both at paid and unpaid production, so sort of earnings, but also unpaid production, so increase in being able to care for relatives or care for grandkids or other unpaid production like cooking meals and driving people around and things like that. And it looked at different scenarios, so it looked at conservative, moderate, and then the NHS elected recovery plan for England. So if this was achieved, what would be the difference in productivity? What it doesn't give us is the difference in how many jobs would be kind of retained, which I think would be interesting to look at as well. There are a lot of economically inactive people who want to work, so even people who are long-term sick, and there's quite a lot of people in the UK who want to work. And over the last 20 years, the UK has actually seen fewer people leave the labour force than would be expected given population ageing. So we talk about sort of demographic sort of time bombs, but the previous demographic time bombs haven't been as bad as we thought they would be, I guess. So there's kind of room for hope there. And employment has increased over time for people with health problems and disabilities. So you can see the proportion of people who are in employment in 2013 and 2022, some big increases. For instance, depression has increased quite a lot. But for pretty much all of these, I think most of them have increased over time. In fact, all of them have, haven't they? Yeah. And overall, for people with any disability, it's increased from about 45% to about 55%. So it's positive, but you can see there's probably still a lot of room for improvement. And I think the things that have changed since the pandemic, so people being able to work from home more and things like that, may help people with disabilities, but there might be other reasons why it wouldn't help people as well. And in terms of people, this is looking at people all working age, so it's not looking only at older people, but there's been quite a big increase in people out of work due to long-term sick through mental illness and nervous disorders, problems connected with back and neck, so musculoskeletal problems, and also other health problems and disabilities, which could be partly long COVID, but the biggest increase was from 2019 to 20, so it was kind of before the pandemic. And I think overall, I'm sure that long COVID has some impact on this, but I think it's probably not a major factor in these changes over time. So to summarise this, people leaving the workforce due to long-term sick is increasing in the UK and in Wales. I think we don't know how much of this is due to increased risk of health problems after COVID. So there's quite good evidence that there's an increased risk of CVD, cardiovascular events, after COVID infection. And this might actually be more significant than, say, the risk of long COVID. And so this might be an increased risk of health problems. And I think all other things like musculoskeletal and mental health problems may have also increased since the pandemic. And also NHS waiting lists, we don't know how much of an impact that is having. It will be having some impact. And I think probably people who are already long-term sick, it's probably taking them further away from being able to go back to work. So in terms of the policy response, I think it's probably things like, and I'm sure we'll hear a lot more about this from other people today. So this is kind of, just sort of my ideas really. I think focused on keeping people in work. So I think it's harder to get people back to work who've left work than it is to keep people in work. Focused on good fair work. So look at working conditions and pay and things like that. Particularly say for people who can't work from home, then how do we substitute for those flexibilities if people can't work flexibly type thing. I think focus on SMEs, small, medium enterprises, because the majority of people in private employment in Wales work in SMEs, and SMEs don't always have very good occupational health services or kind of awareness of occupational health things. I think focus on mental health and musculoskeletal problems, because this is what's taking people out of the workplace most. So can people access mental health services? Can they access musculoskeletal help, physio and things like that? I think have a health first biopsychosocial approach. Think about how we use allied health professionals, because allied health professionals can sign off fit notes. Are they working with the rest of the sort of benefits system and with the health system? And AHR have got a research call around this. I don't know if it's closed actually, but they had one earlier this year. In terms of what are the best buys for policies, we're still working on this at the moment. So there's we're looking at having a review from the Health and Care Research Wales Evidence Centre. But I think there's things that we can do. For instance, we've got Silver Cloud, which is online CBT, which is funded by Welsh Government. So I think maximise the use of things like this. There's good evidence on return on investment for mental health programmes for employers. I think maximise the impact of the in-work support contract, which I think has recently been recommissioned. And I think there's good evidence for physical activity at work, so reducing sedentary behaviour and getting people moving, basically. So questions about, do we need faster access to things like CBT and counsel and mental health services? Reinforced to employers the cost of labour turnover per person leaving, so the value of keeping employees healthy. So this looks at the cost of labour turnover, and you can see in most industries, and it's from a few years ago as well, so it's nearly 10 years ago, even in say retail, where you might think you can replace people at quite a low cost, it's still around £20,000 per person in terms of the logistical costs of replacing people, but also the productivity losses of training new people up. So I think reinforcing this to employers is really important. So I'll stop there, thank you. And I'll hand over to Lois, who's the next speaker. Thank you.
Diolch, Brendan. I'll just get my slides up for you all. Okay. So pnawn da, everyone. Thank you very much for joining, and thank you very much for the opportunity to talk today. I'm Lois. I'm a research officer in the Research and Evaluation team in Public Health Wales and the Centre for Population Health. I think an idea that will probably weave through all of the presentations today is that the jobs we do and the characteristics of how we do them shape our health. Changes to our work may therefore change our health. And one of the most obvious changes in the world of work that we've experienced in recent years is the shift to working from home that occurred due to the COVID-19 pandemic. So today I'm going to be sharing some findings from an evidence briefing that we published back in December that explores the links between home working and health. Using data we gathered in Public Health Wales is COVID-19 Employment and Health in Wales survey. The survey was conducted during the pandemic to gather unique insights from those living and working in Wales about their experiences of work and their health. I'm sure that each of us here who has worked from home or is working from home to some extent can agree that there are pluses and minuses to it. And one of the most commonly discussed benefits is the added flexibility that it offers. Flexibility is a key characteristic of fair work, something that Welsh Government are prioritising within their employment-related policies. And in March 2022, they noted their ambition to have 30% of workers working remotely regularly in Wales. However, if we are to have a large proportion of the population working remotely regularly, it's important that we spend time trying to understand the ways in which it might interact with health. There's a scarcity of evidence that demonstrates the ways in which the shift to working from home impacted health and health inequalities during the pandemic. Through our research, we wanted to provide some insights that would help us understand how to both promote and protect health as people adopt these new ways of working going forward. So we focused on 3 research questions through which we aim to characterise variations in the ability to work from home, establish the ways in which home workers' health and well-being were impacted during the pandemic, and explore preferences for future home working. The survey itself was conducted in 2 waves. However, questions on working from home were only included at time point 2, and this happened to coincide with the second wave of the pandemic in Wales in winter 2020-21, something that's quite important to consider when we think about generalisability. 615 individuals responded at this follow-up stage, and if anyone wants further details on the recruitment, the survey design and the analysis, I'd be happy to have a chat with you, and I'll share the links to the briefing itself after I finish talking in the chat. So today I'm going to show you some of the trends that we saw across the whole sample using weighted proportions, and I'll quickly refer to some examples of the ways in which people's responses to our 3 key research questions varied dependent on social demographics, employment and self-reported health. And those findings come from chi-square analyses and adjusted logistic regression models. Again, do reach out if you want to know more about those. So turning to the findings, the ability to work from home was quite evenly split across the working adults asked. About half could and about half couldn't. That did, of course, vary across population groups. And as quick examples, women were twice as likely as men to report being able to work from home. And only 1/3 of those with poorer mental well-being could work from home, compared to about half of those with better well-being. Moving on to self-reported health impacts, we saw that these were quite mixed for some aspects of health. For example, about 1/3 said that their levels of physical activity decreased when they worked from home, but 1/3 also said they improved. And we saw similar patterns for work-life balance and dietary behaviours as well. Effects were a bit clearer for mental well-being and feelings of isolation. So 1 in 2 said they felt lonelier when working from home, and 1 in 2 felt that their mental well-being worsened. And some groups were more likely to report some of these negative impacts. And as quick examples, people in their 30s were 3 times more likely to say they felt lonelier when working from home, 4 times more likely to say their diet worsened, and 6 times more likely to say they exercised less. People in poorer general health were also more likely to report deteriorations in health behaviours, being more likely to report worsened diet, levels of exercise, alcohol use, and smoking habits. So health impacts were quite varied, and we were curious to see how this might feed into people's preferences for future home working and how those preferences might differ dependent on social demographics, job characteristics, and health. We asked everyone, regardless of whether they could work from home at the time, what would be their preferred working models for the future. We found that 3 in 5 adults in employment in Wales wanted to spend at least some or all of their working week working from home. Almost half preferred a hybrid approach, while 13% wanted to work from home full-time. But nearly 1 in 5 wanted to avoid home working entirely. When comparing across groups, we saw that young people, those living alone, those living in the most deprived areas and those with worse mental well-being wanted to spend less time working from home, whereas women and those living with children in their households were more likely to want to spend more time working from home. In addition to those comparisons, we thought it was important to look at how the responses differed across those able and unable to work from home at the time. And despite some of the health impacts I discussed earlier, the vast majority of those that worked from home during the pandemic wanted to continue to do so, with 66% wanting to work with a hybrid approach and 21% wanting to work from home full time. Only 9% wanted to avoid home working entirely. Those that were unable to work from home during the pandemic were, unsurprisingly, a bit less clear on their preferences, with about 40% saying they weren't sure what their preferred working model would be. However, about a third of these individuals wanted to adopt home working going forward, and about a quarter said they'd prefer not to work from home at all. I mentioned earlier that it's important to keep the timing of the survey in mind when we consider the findings. When the data was collected, restrictions on socialisation were in place, and many of those that were working from home hadn't yet had the opportunity to go back to the office. So hybrid working was something that many people were yet to experience. Our findings therefore capture people's perspectives and experiences during a unique time point. And for that reason, it's important to contextualise the results in relation to working patterns more recently, since restrictions have been eased. That being said, many of our findings are consistent with what more recent population surveys have found. People do seem to want to continue to work from home, albeit in more hybrid ways. As a quick example, the ONS Opinions and Lifestyle Survey in February 2022 showed that 80% of Welsh workers who worked from home during the pandemic wanted to continue to work in hybrid ways. For us, this proportion was 66%. For health, research has shown us that across the board, well-being did deteriorate during the pandemic, but the UK Household Longitudinal Study showed in January 2021 that psychological distress was a bit higher amongst those that did work from home than those that didn't. In a later wave of that same study in September 2021, by which time most of the sort of UK COVID restrictions had been lifted, they also found that psychological distress was higher among those that were working from home, albeit psychological distress had become a bit lower than January 2021 across the board. That being said, the causal relationship between sort of the increased level of psychological distress in those working from home can't really be determined. It could be that working from home causes a bit of psychological distress, or that those that are experiencing psychological distress weren't returning to site-based work at quite the same pace. So really, I think one of the key messages is that there's a need for more research in this space that explores these questions now within a working context where hybrid working is accessible and some of the pandemic-related stresses are less evident. The persistence of home working practices now in 2023 suggests that people value some of the benefits it can offer over site-based work, with these gains possibly outweighing the costs to mental well-being as workers decide how to spread their time. With Welsh Government intending to have 30% of the workforce working remotely regularly, it's vital that we continue to monitor people's preferences and behaviours, evaluate current practice, and take action to support people's health. Equity should really be a key consideration within that as well. So when we think about who's able to work from home, we should be asking how can we support those that are less able to work from home to work in more flexible ways? And when it comes to health, who's most likely to need support and what aspects of health might these people need more support with? In our view, we should be striving to see more people experiencing the benefits of home working and helping people to protect against some of the potential harms. And that's really crucial if we're to ensure that any shift to more regular remote working is done with health in mind. So that's it from me. These are some quick references to some of the other papers that have come from the same survey, which covered a range of things, including precarious employment. So I'm biased, but I would encourage you all to go and take a look at those. But yeah, thank you very much for your time. I'd also like to say thank you to my colleagues, especially Ben Gray for all his work on this, and Kieran Humphries and Miriam McKibben for supporting with the sort of getting the message out about it as well. But yeah, thank you very much. I'll pass you on to Elisa and Geraint next for the next presentation. Diolch.
Diolch. Thank you, Lois. We are just opening up the slides now. Window.
Oh, there we go.
Fabulous. Okay, hopefully we will just see our screen. We are just bringing up the slides as we speak. I said, hopefully you can now see our slides. Today we're going to be talking to you about the Engage Change Employment Project. We're looking at learning disability, autism and employment in general.
There we go.
Fabulous. Okay. My name is Geraint Griffiths. I am the lead ambassador for the Engage to Change project. My role is speaking to young people on why they should be in employment, and likewise to the employer on why they should be employing young people in their workplace. I chair several conferences on national level, and I chair presentations such as this online and in person. And I'm going to pass on to my colleague, Elisa.
My name is Elisa Vigna, and I'm a research associate at the National Centre for Mental Health at Cardiff University. And together with other researchers, you can see Andrew Meek, my colleague Andrew Meek in the slide, and Stephen Bayer as well. We are in charge of the evaluation of the Engage to Change project. Beside my work as a researcher, I've also been a mentor to 12 interns with learning disability and autism. At the moment, we are we work quite closely with Geraint on the dissemination of the research outcomes. We produce easy read documents, accessible videos, and anything that is helpful to promote the project and its legacy.
Have you ever thought about what people with learning disabilities and autism do once they leave their education? Did you know that only less than 100 go into employment? The Engage Change project aims to challenge this. Engage Change is a pan-Wales employment project aiming to support young people aged 16 to 25 who are NEET and have a learning difficulty, learning disability and or with autism. These are the organisations, as you can see on your screen, who are involved in this project. Engage Change is due to end in May this year. In total, 1,070 young people have been supported in Wales by the Engage Change project. The project has offered 451 paid placements and 506 unpaid placements. 233 young people took part in a supported internship. 7 supported internships in total were activated under the Engage Change project.
So in the project, a total of 526 employers were involved. Of those, 397 employers offered paid placements. 420 people started a paid job in the open labour market and are now contributing to the Welsh economy. The employment rate for the project is 39%, which is a great achievement considering the low rate for this group and the impact of the COVID pandemic.
How can we support these young people like myself with learning disability and or with autism into work? In this project, young people have been supported with a needs-led approach, person-centered. This is a 3-steps model that we like to call place, train and maintain. First of all, a job coach provides a specific vocational profiling to advise and guide the young person to establish a potential career path. Then a job is found that is right for that specific person, trying to find the best job match. Train. The job coach analysis, the task and train the young person focusing on what is required for that job. The young person learns the tasks in the workplace that must be performed to the employer's specifications and high standards. Intense job coaching support is provided from the very beginning. That is fading away naturally over time when the young person is becoming more independent and more confident.
So support is also provided for young people to learn the interpersonal skills that are necessary to be accepted as a worker in the workplace and communicate in an effective way with colleagues. What is also offered is route familiarization to get into work and proper travel training so that the young person can actually travel to work independently. Then, during the maintain phase, the support is still available with long-term sustained employment through like monitoring a less intensive activity, and also looking at career development if, for instance, a young person wants to move on and go for a promotion or go for another job.
Better employment opportunities has led to increased social mobility and social integration, which in turn leads to improved well-being and quality of life for young people living with autism and or with a learning disability. Have a look at the self-reported benefits. Young people experience more confidence, they find easier to speak to people, they know what to expect from their employer, they understand money better now than ever before thanks to their one-to-one job coaches. As they are earning their own salary, they are becoming more independent, traveling by themselves, doing more things for themselves. In total, they are feeling more control over their lives.
This was possible because job coach support help young people feel more confident, and that helped to decrease work-based anxiety. Participation in work provides a sense of purpose, obviously, and means that people have the opportunity for a healthy lifestyle, as we saw in the project, for themselves and to help them to realize their potential and become part of actually the active community. So the Engage to Change project help people maintain employment and supported well-being also through COVID pandemic. That was possible through one-to-one support or through job clubs, where actually job coaches run this club with multiple people. That was obviously done online. And there also been many different well-being activities. One of those was run by Garant and was organized on a weekly basis, where actually people were getting together socially. That was called the Fun Hour because there were lots of quizzes and lots of activities. And that was really well attended because, you know, that was the only way actually young people could get together during this difficult time. Okay, and then so in our research, we listen to young people, their families, employers, workplace mentors, and we have learned that people with learning disabilities and or with autism can work with the right support and the right job match. So we know what works. We know that supported employment and job coach are key to increase the employment rate for this group. So obviously the project was really successful. There are now 17 supported internship sites in Wales that are the legacy of the Engage to Change project. However, there is a need of a national supported employment system to make sure that everyone with a learning disabilities or with autism can actually access it and make, be able to kind of get into employment and benefit from all the health benefit that employment can bring to them, their lives.
As we mentioned previously in this presentation, Engage Change is finishing in May this year, so less employment opportunities will be available for the future generations. How are we going to respond to this? We would really like to hear from you and get in touch. Our contact details are on the screen. If you want to know more, like I've said, please get in touch. We have a range of reports, easy-read documents, accessible videos that was co-produced with young people from the project, including working with Andrea and Elisa. All of our materials and resources are available in English and Welsh. If you are on Facebook and Twitter, please keep an eye on those, because we have started using infographics. So they were going on there now weekly. So they're really up-to-date resources if you want to get your hands on them digitally. We're staying for the Q&A later on, so we'll be happy to take any questions from you if you do have any. And thank you for listening. Diolch yn fawr. We are now going to hand you over to Mary Ann.
Good afternoon, everyone. Just pull up my presentation. Great. So I'm Mary Ann McKibben. I'm a consultant in public health within Public Health Wales, and I lead some of our healthy settings programmes, including our 2 programmes on health and work, or 2 of our 3 programmes, I should say. We're within the Health and Wellbeing Directorate, and today I'm going to talk about the Employee Health Management Programme and the Healthy Working Wales programme, really with a view to, I suppose, linking to some of the previous presentations and talking a bit about what we're kind of doing within Public Health Wales to take some of these agendas forward. Now, I just wanted to start with a quick overview of the 3 programmes that we have within the Health and Wellbeing Directorate. The Wider Determinants of Health unit has done some fantastic work around fair work in particular, which we've closely collaborated on, and it's been great to support their development of some key resources around fair work. Now, I'm not going to talk about fair work in detail today. I'm going to talk about the other 2 programmes that are up there. So Healthy Working Wales, which has been around for 15 years. It focuses on working directly with employers to promote healthy and safe workplaces and support employer action around all sorts of aspects of health and well-being. And a key part of what we're trying to really beef up with Healthy Working Wales is also support employers around encouraging the recruitment and retention of disabled people and those with long-term health conditions in the workplace. But first, I'm going to talk about the Employee Health Management Programme, and that's one that we set up just slightly prior to the pandemic, which was really in recognition of the high numbers of people who fall out of work due to ill health, and that rate, I think, is one of the highest in the UK within Wales. It's higher than England, I understand, and it's we've tried to set up this programme which is about multi-agency working. So I'm going to sort of talk in a little bit of detail about that to start with. So just to kick off, in very, very simplistic terms, I'm not digging into the stats here. Brendan did a great job of that earlier, and there's more that could be teased out around this agenda. But overall, in simplistic terms, being in work is good for your health. Being in good quality or fair work is even better for your health. There's no doubt about it. And being out of work is generally bad for your health. So, much higher levels of ill health amongst those who are out of work. Now, we very much recognise with the Employee Health Management Programme that sickness, absence and how it is managed within the workplace is a really key aspect of this. Because the longer, if you manage sickness absence well within the workplace, it is more likely people will come back to work. The longer you are off work, the more likely it is that you will fall out of work, that you will not return to work. And something that's come out of our discussions and work with primary care in particular, and with employers, is that recognition that how your return to work is handled after you've been off for a long period is critical to whether you thrive and stay at work or whether you go off sick again. That is such a crucial point in the journey, and then potentially fall out of work completely once you've been off for a long time. This is the partnership we set up to take forward this programme, multi-agency, as I mentioned, with the aim of preventing people from falling out of work due to ill health and reducing the big gap, 30% gap in employment between disabled and non-disabled people. So that was a key part of what we were trying to do there. And as you can see, partners have included unions, employers, health professionals, so occupational health, allied health professionals, but also primary care, really key partner in this, The DWP, Department of Work and Pensions, are a really important partner for us in terms of, you know, how we look at this jointly and how we hopefully take some joint approaches. And then we've also got their Health Education Improvement Wales to look at, you know, how do we improve understanding amongst health professionals in particular about why work is good for your health and why it's important health professionals support that in whatever way they can, as well as support from CIPD, Chartered Institute of Personnel and Development, so the HR angle, as well as Welsh Government and academics from the Cardiff University. Sadly, this programme is actually currently suspended because we just haven't got the funding capacity to take it forward. Rachel, our wonderful chair today, was on secondment with us, sort of really focusing on this and taking the work forward with partners. But sadly for us, had to return to her substantive role for the time being. So, and that's just. There was a real head of steam when we've met with partners, when we had a partnership meeting, a real head of steam, real commitment by these partners to take action on this agenda. No doubt about it, we were all on the same page. We all could see that we were better together rather than trying to fiddle about and do work on our own, that we were better to join forces and just try and develop a multi-agency strategy. So I have high hopes that this will get off the ground again in the future. Our programme objectives, which we all signed up to, included in, you know, creating greater understanding of the health and work relationship, as I mentioned earlier, for example, in the training of health professionals, raising awareness of and addressing the needs of specific groups in the workforce, for example, older workers or disabled people, or, you know, different groups with different needs. Developing mutual understanding and action between key agencies, and the big one that leaps out to me there is DWP and primary care, actually, and sort of developing that relationship at a local level between DWP work coaches and those working in primary care about how we can support people to get work, stay in work. In-work support services are crucial to this. So how, you know, they provide rapid access, Welsh Government funded rapid access to mental health services, rapid access to physios. So helping to address some of those key issues that are the reasons for people falling out of work or being off work. So what are the mechanisms for better integrating and publicising those services and initiatives? Improving sickness absence management, as I mentioned earlier, and how we can do that, you know, with employers, with line managers, and using the Fit Note more proactively as a key tool, and developing joint resources where we identify gaps. So we've just finished doing some employer research. This is building on previous research we undertook in 2019 and 2021. We've only got the initial results so far, so I wasn't able to provide you with any glitzy graphs or anything, and we'll hold a separate event to flesh that out in a bit more detail. But we asked employers about the health conditions they're most concerned about over the next 12 months amongst their employees. Mental health issues, front and centre, is the biggest issue, and musculoskeletal issues is the second. And this reflects Fit Note data from England. We're hoping to get the same data for Wales, but we haven't got it yet. But the Fit Note data for England tells us that musculoskeletal issues are the biggest reason for people going off sick, for having a Fit Note over and above minor illnesses. Like viruses, but actually when you look at long-term sickness absence, then mental health is the big one where we need to be taking more action. They've also told us that they want, you know, better information to make Fit Notes more useful, recommendations on how to support employees and guidance on return to work procedures, and importantly, more than half are unaware of access to work funding, which is available to help, you know, put adaptations in place in the workplace to facilitate a return to work for someone. And 70% were unaware of support with Employee Health and Disability Service, which I think was launched last year, which provides free advice and support to employers around supporting employees with disabled employees and those with health conditions. Those are both DWP services that are free for employers. So we need to do more work there to publicise them. Now, I'm just quickly going to talk about Healthy Work in Wales as well, because of that overlap in that Venn diagram. You know, we've got all of these areas overlap, and Healthy Work in Wales is a key vehicle for working with employers and supporting employers with guidance and information. And we've revamped it. We've significantly increased our digital offer with a big focus on our website content. And I mean, some of the other stuff we're doing is captured there. I won't go into a huge amount of detail, but we do want to be developing some much more tailored sector specific approaches to reach higher risk groups, you know, where there's high levels of low pay, precarious contracts or occupational risk, to contribute to addressing inequalities in health. And also, what else can we do to support SMEs who have less capacity and resources to really do much in this space? So our website content is trying to reflect and deliver on population needs and what's happening in the national policy arena and health priorities, and obviously evaluating what we're doing, and the impact both at an employer and programme level is crucial to that. Here's a quick look at our work streams, if you like, through Healthy Work in Wales, and the different parts of our website and what we're trying to do with topic modules to provide employers with action, you know, action planning. What can they proactively do on that issue? Some of the ones red ringed relate to the employee health management agenda and supporting people to stay at work, supporting employers to keep people healthy at work and support them in whatever way they need. And then finally, a quick spotlight on our mental health and wellbeing pages. Do go online and take a look, but they include, we revamped them last year, guidance, resources, case studies of what real employers are doing in this space, templates to support action planning, as well as, you know, direction to support services and guidance. So finally, encourage you to sign up for our monthly e-bulletin on the Healthy Work in Wales website. And those are our ways of contacting us and our social media channels. So I will stop there and hand back to Rachel. Diolch. Thank you.
Diolch yn fawr. Thank you, everybody. That was a really interesting set of presentations, illustrating the breadth of issues, some of the solutions that we have in Wales. Remember, everyone, if you want to ask some questions to a presenter, please put those in the chat, preferably identifying which presenter the question is aimed at, just for my benefit, if that's possible. We have a couple already. A question from Katie for Brendan, and the question is, are there more people with health problems in the workforce because policies and workforce conditions have improved, or is it that there are more people who have those conditions but they have to simply keep working because of financial pressures?
Yeah, it's a good question. I don't know for sure. I suspect it's a bit of both, but I think it's people are definitely working to older ages, and that means that they're more likely to have more conditions, and we're seeing quite an increase in multimorbidity in particular. So I think in terms of the policy response or the health service response, I think it's trying to prevent people from having those second and third conditions is what we need, or for people who have got multimorbidity, trying to help them to have the flexibility that they need to stay in the workforce.
Fab, thank you, Katie. I hope that answered your question. And then I have another question here from Rachel. So this is about the impact of COVID infection, not just about increased CVD risk, but also neuromental health outcomes, impacts to immunity, for example. So the question is around, should we also not be making workplaces safer from COVID as well? So clean air, better comprehensive financial support for COVID sickness, etc., for example. So basically the question is, our focus seems to have moved away from COVID and curbing COVID infections? And should we actually be returning and thinking about making workplaces safer, especially as evidence mounts on how it damages multiple systems within the body? I don't know, I think that was originally to you, Brendan, but I don't know if that's something, Marianne, you want to also comment on.
I'm happy to start. I mean, a lot of my work that I've done the last 3 years has been COVID response stuff. I agree. I think that we need to do more about trying to reduce the spread of COVID and other respiratory viruses in the workplace. And hopefully, I think there's a change of people staying at home more if they've got symptoms. I don't know how many people are testing that often for COVID anymore. I think people probably had stockpiles of free tests, and they're kind of getting to the end of those stockpiles now and thinking about being quite strategic about when they use them. So I think that yeah, I think we definitely need to do more. We need to look at the value for money of what we're doing as well. So, you know, there's a lot of things that we could do that are very expensive in terms of ventilation and things like that. So, and you've got an opposing force of fuel prices being very high. So it costs a lot of money to heat places as well at the moment. So, I agree that I think we definitely need to do more and consider the whole approach to respiratory viruses and getting people to stay at home and making it socially acceptable for people to stay at home when they've got symptoms, which I think it is in probably some industries, is probably where, you know, if you're in Public Health Wales or in Welsh Government, I think people are happy for you to stay at home if you've got symptoms, but other jobs it might be more difficult to do that.
Absolutely.
I mean, I think it remains a fraught area, really. I think you know, there is inevitably some complacency creeping in now around COVID and sort of not worrying about it in quite the same way. You know, there's some key messaging that we can kind of continue to promote, as Brendan outlined, around, you know, staying off work if you are ill, but it does need to be set in that wider context of as we saw throughout the pandemic. For example, we did quite a bit of work around temporary workers, agency workers, and, you know, needing to go to work, otherwise they don't get paid. So, you know, it's a really fraught area, not just in relation to COVID and obviously those, you know, those longer term impacts for a proportion who do get COVID, but in relation to other respiratory illnesses that can be spread by being at work, and what the impact on the employer is of that, of people actually going into work when they're ill, and you know, then that kind of longer term impact really on productivity and that kind of business side. So encouraging employers to really think about that. We've just revamped the infection prevention and control section of our website, which hopefully will be launching soon, which will, you know, hopefully go some way to promoting some of those messages and keeping them top of mind for employers. But I do think that's an important question.
Fantastic, thank you. Okay, I've got a question for Lewis. Is your data available by occupation or sector regarding working from home?
So unfortunately, our data isn't, but there is some ONS data available that does sort of break it down by industry and by sector. What they're generally seeing is that sort of higher earners have better access to home working. We also found that sort of people with high wage precarity were less likely to be able to access home working. What the ONS data sort of suggests is that even when you standardize for variations across industries, the percentages are kind of relatively stable, but when thinking about adopting it more longer term, some industries are sort of more welcoming it with more widely open arms, including sort of information and technology. But I'll share the links to the ONS data summaries in the chat now for those that are interested.
Thank you. And a question from Keris. What's on the horizon in terms of threats to keep people in employment? For example, impacts of AI, ongoing recession. Is there any research on this? Does any of the panel have any answers to that one? Oh, that's a tricky one to answer, Keris.
I know that we did look at that, didn't we, Rachel? In the we did a report as part of the Employee Health Management Programme on the landscape of employment and work, which we're hoping to update. I think some work's been done to start to update that when Rachel was with us and publish. But I think the landscape changed so radically since we drafted that prior to the pandemic. I personally, you know, thinking from the point of view of health issues, you know, I think overweight and obesity is going to be have a you know, significant impact as we go forward, and probably already is in terms of things like musculoskeletal issues and diabetes and other kind of long-term health conditions, and what impact that's going to have on a proportion of the population and their health. But yes, Brendan or others might have other ideas in terms of what research has been done.
Yeah, absolutely, and it's interesting, isn't it, how that working from home impacts on all of those things, and I don't think we quite know yet the impact of people being at home, being more sedentary potentially, you know, being at home but having the fridge just downstairs. I'm thinking of myself here, and the difficulty of all of those things and the impact on our own health.
Yeah, and I think, you know, but you've got that side, but also there were some people who were finding it allowing them to be more active. So we need to better understand what is it about those people that enabled them to gain that benefit from it, and how can we sort of try to support that going forward. And I think the recession angle is interesting as well, with the cost of living crisis and home working. I think, you know, with winter and fuel costs and heating the home, that's something that's important to take into consideration as well, with how realistically sort of remote working can be maintained equally across different groups as well.
Indeed. And is it the case, Brendan, did I read somewhere that those kind of sectors where people generally aren't able to work from home, so sort of retail sectors, wholesale sectors, that kind of sector where people have to physically be in work, employees are more likely to drop out of the labour market, especially older employees, rather than, so it feels like working from home might have an impact on whether people stay in work or not.
Yeah, I think I've seen research that says that that's the case. Yeah, and I think it ties in with inequalities as well, because I think it's going to increase inequalities, both in terms of health inequalities and economic inequalities.
Absolutely. So I've just got one question for Lisa and Geraint around the Engage to Change programme and around the learning that you've had from that. Is there any learning that we can translate maybe to other groups? So, you know, our older workers are workers who maybe have impairments or long-term health conditions. Thinking about the work that you've done with your specific set of people, is there some learning that would be useful to other groups, other, you know, less represented groups in the labour market?
Yes, of course. So supported employment is really effective also with other groups, such as people with a sensory impairment. Okay, so I think that the message is, you know, disabled people can work. We can have we can have ways to kind of diversify the workforce even more than that. Obviously, we want more organization from the public sector to be involved, because, you know, it's quite clear from our project, lots of employers were from the private sector, but we would expect that in the future more, you know, public sector organization will be represented, you know, as an employer of people with disabilities. Because what the employers get, they get lots of benefits, because generally speaking, our client group are really loyal to the business. They stay in jobs for a long time. So it does mean that the employers will reduce training costs and will just have a stable workforce. Recently, in the research after the COVID-19 pandemic, and also the increase of cost to life. And we saw that actually people from the project work for more hours, so more than 16 and plus. So there is definitely a willing to just work. So it does work. So I think we just need to find a way to apply it more widely. Gerrit?
Just to quickly add to Lisa's point as well, especially with the learning point that we've discovered throughout the 7 years, is that the project has worked. We've been having meetings now with Welsh Government, quite recently Vaughan Gething as well. We are really pushing to have a job coaching national scheme. So say after engage change finishes, there will always be some sort of scheme that Welsh Government will hopefully put in place, that there will always be something that young people can go to. Because this is really what we're pushing as part of the legacy part of the programme. And through COVID as well, through our interns and young people who come through the project, they've been working in the NHS through COVID, like portering, because we've had a few interns working very closely with Betty Cadwaladr University Health Board in Ysbyty Gwynedd. So there is a very key element here with the NHS, and like Lisa said, we're really pushing to come out the third sector, because obviously this is where we kind of nature and really push, and with the interns feel more comfortable, but pushing those boundaries into other sectors where they can thrive and succeed.
Fantastic. Thank you both. That's all we've got time for today, unfortunately. Many thanks to all of our presenters. We'd be grateful if all of you here could complete a short evaluation, and a link will come through in the chat. And we hope obviously that you're going to join the Public Health Network Cymru if you're not already a member. And then finally, if you've got any thoughts around future webinar topics, please let the team know at Public Health Network Cymru. Diolch yn fawr pawb. Thank you all so much. Lovely to see so many of you, and hope to see you again soon. Thank you.